Hi, welcome back. This video is the last in the regular series, which will deal with the biopsy that I had to investigate what was called the area of interest in my prostate, and the results thereof, and the kind of follow-up and treatment that may or may not happen. The biopsy itself was relatively straightforward. It was a hospital procedure. It was done under a general anaesthetic because I had what's known as a targeted biopsy. There are two forms of biopsy for prostate problems. The first is a TRUS biopsy, T-R-U-S. T-R-U-S means transrectal ultrasound guided biopsy. Effectively, a number of samples are taken by passing thin needles into your rectum, through the wall of your bowel and into your prostate. It's a hit and miss procedure because it's not guided to where there is what's known as an area of interest or suspicion. The alternative is a targeted biopsy where, prior to the biopsy being taken, an MRI scan identifies something and the surgeon is able to take samples from a very specific area in the prostate. In my case, I was fortunate enough to have the targeted biopsy. Fortunate because the route is not the same. They do not stick needles up in my rectum. The area to go in it actually goes through the skin, which is between back passage and scrotum, basically. And although that sounds absolutely horrible, one is given a mild general anaesthetic, and so as far as I was concerned, I felt nothing. The only thing worthy of note really was the way the anaesthetist dealt with my level of anaesthesia, and I experienced the use of a very, very clever piece of medical equipment which placed sensors on my head, measured my brain waves, and calculated from numerous brain waves how deep my level of consciousness was, and was able to adjust the anaesthetic along the way as it was happening, which is a pretty precise way of dealing with an anaesthesia. So I checked in the morning, 7:30, as happens in the UK with any operation, was taken down to the operating theatre where the biopsies were taken at 10. It took quite a long time. I don't remember coming back until about 10:40, but really I have no recollection of anything happening. I had a small dressing in my groin, and I had no pain whatsoever, no need for aspirin, paracetamol or anything. I was held in the ward until such time as the doctors were ready to discharge me. I was then sent home. I was not allowed to drive home. Because I had a general anaesthetic, I was not allowed to stay overnight alone. That's normal routine procedure in the United Kingdom. So that was the end of the biopsy, and I then had to wait for the results, which took around 10 days. And I was called back for the results. They were given to me by a senior nursing sister. She happens to be a clinical director as well. And I was taken away from the normal treatment area into what they call a clinic room. It was quite a long way from the main strip of the hospital, and I guess they give people quite bad news in that room. She explained to me that the biopsies were positive, in that they positively said that I do have prostate cancer. At a very high level, it's a very early stage prostate cancer. It's known as a T2, which is localized within my prostate, hasn't escaped at all, and it was found in a small number of the samples, and there are some scores which go along with that. To help me understand what was going on, I was given a really, really useful booklet, quite a large booklet, which I'm going to bend over and pick up now. It was this one here. I hope you can see that. If not, I'll add some stills into the video afterwards. It's called Prostate Cancer, a Guide for Men Who've Just Been Diagnosed. And it has some really tremendous stuff in it. And I'm going to turn now to, some very, very good diagrams. Where are they? Come on, Ian. There, some very good diagrams about what the various stages of prostate cancer are, what the different levels mean, what the different treatment options are, and how to progress. The nurse specialist who spoke to me spent a very, very long time with me. I think I probably had a 50-minute interview with her, we went through every single page of this and discussed where I was and what my options are. Now in this case you can see here that she's ringed the problem that I'm facing, and she's ticked off the various options. All the options, I'll read all the options to you. It's localized prostate cancer. The options are active surveillance, watchful waiting, surgery, which means a radical prostatectomy, that means they take the prostate away or part of the prostate away, external beam radiotherapy, brachytherapy, which is where they place radioactive seeds inside the prostate, high density focus ultrasound, or cryotherapy. Now in my case there are two crosses, which mean watchful waiting and cryotherapy are not suitable for very early stage like this. The interesting thing was that it was my choice as to what happened. I was given a lot of options and it was recommended that I follow active surveillance. That means that every 12 weeks I will have a clinic visit. I will be assigned a specialist oncology nurse who will monitor my any results that I have, any symptoms that I have, and if necessary recommend further MRI scans or biopsies. But at this point in time, not do any treatment as such. However, it was pointed out very clearly that if I woke up in the middle of the night shouting, "Oh my goodness, I've got cancer, get rid of it, I don't want it in my body," then any of the other options were open to me, and all I had to do was telephone my named oncology nurse. Her card is in here somewhere. I have a direct line to my named oncology nurse, and I'd make an appointment, she'd talk to me, and we can talk my way through the various options. At this moment, as I said, I have adopted active surveillance, which means regular 3-month appointments. Sometimes active surveillance and watchful waiting are muddled. Watchful waiting means nothing happens unless one gets more symptoms. It's used typically for older patients for whom regular visits to the hospital, regular blood tests, further MRI scans, further biopsies would be quite difficult to take. For somebody with my sort of outlook on life and mobility and age and things, it wasn't really an option. So I'm on a more active program than that. One interesting factor that came out of the discussions that I had was that I noted, and it hadn't been really noted during my investigations, was that I've had a low testosterone level for quite a long time. Now, it is possible that a low testosterone level can create a lot of symptoms, and some of those symptoms I've been experiencing. But more importantly, if a man's testosterone is low, his ability to deal with the growth of prostate cancer is weakened. And so I was referred to another urologist for the possibility of receiving testosterone supplements, which will bring my overall level of health back. There are some autoimmune and lifestyle things that are going on with me that a testosterone supplement may deal with. And so I was referred to that urologist. In a future video, I'll describe what happened and what's going to happen about that testosterone supplement, whether it's suitable for me or not, as we progress through this series. But for now, the end of this is that the biopsies were taken. Those biopsies showed that I do have prostate cancer, that the prostate cancer is localized within my prostate. There is no area at all that's broken out, and that's really, really good news for me, because it means it can be dealt with. There's no real knowledge right now of how fast that's growing, because it's the first time it's been monitored. It will be now on an active surveillance program for probably the rest of my life, and interventions will occur as time progresses. I have 2 appointments, one in early May with the androgen clinic, which is to monitor the testosterone, and another of my first active surveillance appointments at the end of May 2017, and I will diarise all of those at about that time. But for now, thank you for watching, thank you for taking this journey with me. Remember, if you or anybody you love is thinking or vaguely thinking that they may have prostate difficulties, please get them to talk to a medical professional. This website does not offer medical advice, it can't. I'm just an ordinary chap diarising what's happening to him. Go to see a medical professional. The quicker these things are dealt with, the quicker you can be on some sort of treatment program. Thank you, and I'll talk to you again soon. Bye.